Hi everyone, I'm Dr. Poonam. Welcome. Today, we're going to tackle something that can be a source of both huge excitement and, let's be honest, a little bit of anxiety, the Beta-hCG test report.
I know, when you first look at this report with all its numbers and medical jargon, it can seem really intimidating. But trust me, by the end of this quick chat, you'll know exactly what it all means. So, are you looking at your report right now, trying to figure out what on earth these numbers are supposed to tell you? Well, you've definitely come to the right place. Let's break it all down, piece by piece. Okay, so first things first, before we get into the numbers, let's talk about what Beta-hCG even is. So, Beta-hCG, and you don't have to remember this, but it stands for human chorionic gonadotropin. It's a really special hormone. Your body starts making it pretty much as soon as a fertilized egg implants in the uterus, and that's exactly why you'll often hear it called the pregnancy hormone. This little test is actually doing two really important jobs. The first one is pretty obvious. It tells you whether or not you're pregnant. But the second job is also super crucial. It helps your doctor keep an eye on things and make sure the pregnancy is progressing the way it should be, especially in those very early days. All right, let's get to the good stuff, the part you're really here for. Let's crack the code on those numbers. Okay, so on your report, you're going to see a number followed by MIU/ml. Now, don't worry about the units. What really matters are the numbers themselves. Think of it like this. There are basically three zones: a not pregnant zone, a definitely pregnant zone, and then there's this little in-between area we need to talk about. Let's start with the most straightforward one. If your number is less than 5, that's a negative result. It means you're not pregnant. Simple as that. Now, on the flip side, if your level is above 25, well, that's a clear positive. A number over 25 confirms that you are pregnant. But what if you're in that gray area? What if your number is somewhere between 5 and 25? This is where a lot of the confusion comes in, and believe me, it's a super common question. We actually call this the confusion zone because, well, it's not a clear yes or no. It could mean you're in the super early stages of pregnancy, or it might just be a normal fluctuation. The most important thing here is don't panic. Your doctor is almost definitely going to suggest repeating the test in a few days to see which way the numbers are heading. So you might be wondering, okay, I get the yes or no part, but why is this hormone level so important beyond that initial confirmation? Well, it's because this test is so much more than just a one-time snapshot. It's more like a movie. It gives us a window into what's happening and how a new pregnancy is doing. And here's the really cool part. In a healthy pregnancy, that Beta-hCG number doesn't just sit there. It doubles about every 48 to 72 hours. It's this rapid rise that doctors are watching. By tracking it, they can get a really good sense that everything is progressing as it should. It's also a key way to spot potential issues early on, like an ectopic pregnancy, where the numbers just don't follow that doubling pattern. Okay, so this naturally leads to the next question, right? When should you actually get this test? Usually, your doctor will suggest getting this test done right after you've missed your period. It's especially useful if you're looking for a super early and accurate confirmation. Sometimes it can even detect a pregnancy before a home urine test would show a positive. And this is a really important point. A single number is just one moment in time, like a single photo. It doesn't tell you the whole story. What we really care about is the trend. Is the number going up, like we expect it to? That's why doctors will often order what's called serial tests, which is just a fancy way of saying they'll test you again in a couple of days to see that rising pattern. Whew, okay. We've gone over a lot, so let's just do a quick recap of the absolute key things you need to walk away with. Honestly, if you only remember 3 things from our chat today, make it these. Number 1, less than 5, not pregnant. Number 2, more than 25, that's a pregnancy confirmation. And number 3, if you're stuck in the middle between 5 and 25, you just need a retest. That's it. And of course, I have to say this, and it's really important, this is all to help you feel more informed and aware. It's not a replacement for actual medical advice. You should always talk to your doctor about your results and any questions you have. I really hope this helped make sense of your Beta-hCG report and cleared up some of that confusion. You know, if you found this helpful, it will be amazing if you could give this a like and subscribe to our channel. We do a lot of these simple breakdowns of tricky medical topics. Thanks so much for joining me.